Yes. Um, so my name is Vera Staley, and I am one of the co-chief residents at University of Colorado. I'll be presenting tonight with my co-chief, Christina Sarmiento, and then one of our wonderful PGY3 residents, Mark Hieronymus. Incidentally, he's on call tonight, home call, so if he gets paged, I'll jump in for him, but we are hoping to have him involved as well. So to kick things off, again, we're from University of Colorado, primarily based out of Aurora, Colorado, which is just right outside of Denver. And I wanted to start with a few quick facts about our program, just to answer some questions that I feel like frequently came up for me when I was looking at residency programs. This is just a picture at Red Rocks, which is a pretty famous concert venue just outside of Denver that many of us love to frequent when we're able to go to these events that are a little bit closer together. This is a picture of our program director, Scott Laker, and then also our associate program director, Dr. Bill Niehaus, who are very friendly and approachable and have been great leaders for us. And then if you do end up either applying to our program, Mallory Pridey, who's our program manager, you'll probably be talking with her a lot, and she is a wonderful member of our team. We couldn't do what we do without her. So we have 6 residents per year, and we have 1 PEDS combined resident per year. So that's a total of 7 residents each year. We only have advanced program slots, so no categorical slots. So what that means is that everyone comes into our program as a PGY2, and they've done a prelim year or transitional year somewhere else for their first year. For those of you who are applying this year, a couple of good Colorado-based preliminary years to apply to include St. Joseph Hospital, Internal Medicine, which is in Denver. They also have a general surgery prelim year, so if you're interested in a little bit more surgical side, it's actually a pretty nice program. And then also University of Colorado, or CU, Internal Medicine, which is a little more academic medicine, but is a great program as well. And then many of our residents also stay at their home programs, so that's certainly an option, or stay nearby home for their first year. Most of our clinical sites are located on the Anschutz Medical Campus in Aurora, and this has free and designated resident parking at all of our sites, which is great. And we operate on 2-month rotations. We'll describe some of our rotations a little bit more to you, but all of them are going to be 2 months long. And then Epic is used at all of our sites with the exception of the VA. A couple other things. We have 15 days of vacation plus 5 for education, and those can be spaced out throughout the year. And then all of our call is home call, and we do that for full week, so Wednesday to Wednesday. And then all of our PGY2s take all of the holiday calls. So the only time when you're really going to be working on holidays is going to be while you're a PGY2. So what this looks like is that as a PGY2, you work 10 call weeks per year, which means 42 weekends off. And then even fewer, your third year, 6, which means 46 weekends off. And then PGY4 year, you have 3 home calls, which is for a total of 49 weekends off. So pretty great time to be able to explore Colorado. And then our didactics are generally attending-led. We do have a couple of resident-led didactics. It's every Wednesday from 3 to 6 p.m. We all come together, or right now, getting together via Zoom, and it's protected time. Our didactics include everything from EMG and ultrasound workshops to attending-led presentations to kind of small group work as well. So I wanted to touch a little bit before we go into all of our different clinical sites, some commonalities and things that drew me to this program. So we have a really great breadth and depth of experience. We cover all areas of PM&R. From inpatient and consult standpoint, we're seeing patients that are very medically complex at our university location. We're seeing a lot of polytrauma at both our university and kind of county hospital locations. Our VA hospital is more kind of bread and butter rehabilitation. And then we also have a VA SCI unit, which allows us to do more specialized SCI care across the continuum, from acute injury to chronic and wound care management. We also get to rotate at Craig Hospital, which is a brain injury and spinal cord injury hospital. So we're really getting to see a wide variety. We see a lot of patients with polytrauma. We work at 2 different level 1 trauma centers at Denver Health and University of Colorado Hospital. Our children's hospital also sees trauma patients. I also wanted to highlight our prosthetics experience. So our VA is a regional amputation center and serves a really high volume of amputees with an amazing attending that we get to work with and great prosthetists. And then our UC Health actually has some experience with an osseointegration clinic, which is a fairly unique clinic, and we are really happy to be involved in that as a PM&R department. And then Denver Health, we get to see patients who have potentially lower resources and also more traumatic injuries. We also have great experience with EMGs, really getting to get a lot of initial experience with the VA, seeing some bread and butter, and then more complex peripheral nerve clinics at both University and Denver Health. And then our pediatric experience is amazing. We'll touch on that a little bit more, but I think the huge draw to our program. And then procedure numbers, no one has any difficulty achieving numbers. You're getting hands-on experience with spine injections, joint injections, Botox, phenol, baclofen pump refills, and EMGs. And I think this is a strength of our program as well. I'm gonna go ahead and turn it over to Christina Sarmiento.
Hi everyone, I'm Christina. I'm also one of the co-chiefs. So I'm gonna just talk a little bit briefly about some of these clinical sites in detail that Vera did a great job highlighting. And so this is just kind of a map of Denver and our major clinical sites. So on the left of the screen, you can see our mountain icons. So that's indicating that mountains are to the left or to the west there. Just east of that, we have Denver Health, which is our county hospital that we get to rotate at. A little bit south of Denver in Englewood is Craig, our freestanding specialty rehab hospital. And then up in northwest corner, technically in Aurora, is our main Anschutz Medical Campus, which is home to the majority of our hospitals, including UC Health, which is our main university hospital, our VA hospital, and then Children's Hospital Colorado. And just kind of highlighting some neighborhoods in different colors where residents typically live. So you can see the vast majority of residents live within fairly close proximity to all of these different clinical sites. And something that's amazing about Denver is that everything is like 15 to 20 minutes away no matter where you are. And so this just kind of highlights distances between common areas to live. So a city park neighborhood is a popular area to live. 18 minutes to our main Anschutz campus, 12 minutes to our Denver Health campus, and the furthest drive would be to Craig, which is about 22 minutes, all with varying degrees of traffic. So University of Colorado Hospital, or UC Health, again, that's located on our main Anschutz Medical Campus. And the campus as a whole is fairly new as well. So this hospital opened in 2004. It's a level 1 trauma center. And I think a highlight is our 12-bed rehabilitation floor, as well as our UCH Spine Center, in which the director of the Spine Center is and always will be a physiatrist, which is something that's unique. And then we also get to rotate within the UC Health system at our CU Sports Medicine and our Boulder Sports Medicine Performance Center. So that's actually northwest in Boulder, but is a really cool opportunity to work with some of the high-performing athletes in this area. And so you can see here a list of some of our rotations that we do at the University of Colorado Hospital. So kind of what you might expect are inpatient and consult rotations. Again, getting to see the high complexity patients, so cardiac rehab, cancer rehab, transplant rehab, in addition to your more bread and butter stroke, amputee patients. We also have an inpatient senior rotation, which allows more senior residents to take more of a supervisory and teaching role, which is a great experience. And then our outpatient rotations include neurogeneral, in which we get to work with some of physiatrists that specialize in neuromuscular rehabilitation and neuromuscular conditions, our outpatient spine rotation, and then our sports and spine rotations as well. And so Denver Health, that's the hospital that's located more in the heart of downtown Denver. And this is our county hospital, so kind of the safety net catchment for the city and county. So you get to see a really diverse patient population, which is awesome. It is also a level 1 trauma center and has an 8-bed rehabilitation floor. So a fun fact is the book, The Knife and Gun Club, was written about Denver Health's emergency department. So the rotations that we get to do at Denver Health include our inpatient and consult rotations. And so you get to see a lot of different trauma cases at Denver Health, both on the inpatient and consult side. So a lot of polytrauma, a lot of traumatic brain injury, spinal cord injury, and you also get EMG experience both on your inpatient and consult rotations, which is a nice opportunity to start getting to see some of those EMGs earlier on in your training. And our VA hospital, again, is located on that main Anschutz Medical Campus and is very new, so opened in July 2018. And so it's large, and we'll have a picture of the inside, and it's beautiful. So at the VA, we have both our general rehab inpatient service as well as a specialty spinal cord injury service. So you can see pictures on the right of the inside of the VA, which looks more like an art museum to me. And so some of the rotations that we get to do at the VA include our general rehab inpatient rotation. So again, kind of stroke, amputee, brain injury. Our consult rotation, which also incorporates outpatient clinics, which is a nice balance between consults and outpatient. And then relatively new, when the spinal cord injury unit opened, when this VA opened, is now our dedicated spinal cord injury rotation at the VA. So this is a really nice blend of both inpatient and outpatient spinal cord injury management, and allows a little bit more delve into spinal cord injury rehabilitation. Our outpatient rotation, so we get to do a neuro rotation and focusing on neuromuscular medicine, amputee medicine, so neuro rehab, our more general musculoskeletal medicine, and then a dedicated EMG rotation as well. And then Children's Hospital Colorado, so we are fortunate enough to get to rotate here, and Children's houses one of the largest cohorts of peds PM&R physicians in the country. Also relatively new on this main Anschutz Medical Campus, and recently this year was named #6 pediatric hospital in the country by US News and World Report. And so what we get to do at Children's is spend at least 2 months there, 1 month doing an inpatient rotation and some consult experience, and then 1 month outpatient. And we have both dedicated rehab unit as well as a huge variety of general rehab and specialty rehab outpatient clinics that we are fortunate enough to get exposure to. And then Craig Hospital, so this is a world-renowned freestanding rehabilitation hospital for the care of spinal cord injury and brain injury patients. So it's just under 80 beds, and all 80 of those beds are for rehab patients. Again, highly ranked in terms of adult rehabilitation hospitals by US News and World Report. And we get to spend a total of 4 months there doing spinal cord injury and brain injury medicine. And those rotations are always back to back, sorry. There's some pictures from Craig. And this is just a sample schedule to give you an idea of what we do each year. And so you can see that there is the majority of your inpatient time in your PGY2 year, but there's still a decent amount of the outpatient exposure built in early on in your PGY2 year, so you can start getting exposure to various different areas of rehab. And this is where Mark's going to take over.
Yes, I'm Mark. I'm a PGY3. Give you a little information about some of the people that are in our residency. So We really come from all over the United States, from California to the Midwest to the East Coast up on the Northeast down to Miami. So really residents from all over, from diverse backgrounds. And want to talk some about our research opportunities. So we do have a scholarly activity required, but to help you with that, we have cohort research mentors assigned for your entire class, and then more specific research mentors for your individual project. They can help you guide and get your project off the ground and get it working, whether you've done no research at all or you come in with a PhD. They can balance that kind of variety. And then we have annual presentations of our resident research, kind of a culmination of what you've done through your 4 years, as well as other opportunities for research, whether that's in quality improvement, other research projects that aren't your required ones. That all kind of depends on your level of interest in research. And then we do have other presentations. We have a grand round style resident seminar where you'll present on a topic that you're interested in rehab, and then smaller presentations, whether that's chair rounds or more informal ones at different clinical sites. And our volunteer opportunities, we have quite a bit. You can be on different committees, whether that's medical education, recruitment, like we're on right now, research, quality improvement, a lot of opportunity for sports coverage, whether that's high school or collegiate. We can work with Aurora Public Schools or the Cherry Creek Public High School sports. Me personally, I cover high school football, and this will be my 3rd year doing it. And then our Payne Fellow covers DU women's sports. So you have opportunity to cover soccer, basketball, volleyball, track, all sorts of different things. And then there's the adaptive ski program at Winter Park, where you can volunteer between 3 and 10 days.
2 minutes.
Okay, thanks. 3 and 10 days a year at Winter Park skiing with people with disabilities. We also have a RSVP clinic where you can work with patients on more of an outpatient basis for rehab conditions. There's lots of races and events you can work at. Some people do pediatric adaptive dance programs. And then we have a medical student interest group that us as residents are pretty involved in. We do have 3 fellowships in our department. We have a pain medicine fellowship. It's 1 year, ACGME accredited. There's a pediatric rehabilitation fellowship. It is 2 years, also ACGME accredited, and we have 2 spots now per year for that. And then there's the spinal cord injury fellowship, which is 1 year at Craig Hospital, 1 person per year. So where do we go after residency? As you can see, this is just very recent grads. They go all over the United States, a little more focused to the West Coast, more towards mountainous towns, because we've all fallen in love with them when we've been here. And then what do we do in terms of jobs? I would say recently more people have been doing fellowships, but traditionally our percentage is about 50-50. And what kind of fellowships are people doing? It's pretty evenly divided, with a little more prevalence towards sports and spine. So thank you guys for your time. We have our co-chiefs emails up there, as well as Mallory, our managers, and I'll put mine in the chat.
All right. Thank you all so much. That was excellent.